thank you everybody for your patience, and maybe a few more people were able to join after a nice lunch. I'm happy to be kicking off our afternoon lunch session, and today I'm going to be talking about my project, which is titled Public Health Ethics and Equity Considerations for Youth Stabilization Care. So I want to make space to acknowledge that I reside on the traditional and unceded territory of the Syilx people in the Okanagan region of BC. My practicum was completed with Interior Health, which also resides and occupies lands of 7 First Nations and is home to 15 Charter Métis communities. And it's with humility and gratitude that I acknowledge the time that I spend in these spaces. I also want to take a moment to express thanks to Dr. Karen Goodison, Medical Health Officer with Interior Health and my practicum supervisor, for her mentorship and support throughout my practicum. So I'm going to cover a background on youth stabilization care, a review of my project known as the Considerations Resource, including pieces on public health ethics and health equity. And then finally, I'll end with some thoughts on the implication for public policy. So what is youth stabilization care? Well, many here will be familiar with the ongoing overdose crisis, or what is now referred to as toxic drug crisis, claiming more than 9,000 lives in British Columbia since the declaration of the public health emergency in 2016. Youth under 19 represent just 1.3% of the overall deaths in BC in 2001. And while this is a really small proportion, it is the 3rd highest cause of death in those under 19. So impact to communities and families when a young life is lost is substantial. And there is a lot of public, political, and community support for various targeted interventions supporting youth who are at risk of overdose death. In 2020, in an effort to address youth overdose, the BC government announced Bill 22, introducing a legislative change to the Mental Health Act to allow involuntary care for youth 19 and under when they present in hospital for an overdose. This period was intended to act as a stabilization time, and BC is one of few provinces without this type of legislation. And it is the 5th attempt since the early 2000s at involuntary care legislation. Pretty immediately, there were serious criticisms noted, and the bill was put on pause pending consultation. Criticisms included serious risk of increasing harm to youth and not reducing it, additional harm to specific populations who are overrepresented in the toxic drug crisis, such as Indigenous people, as well as a lack of empirical evidence to support involuntary care as a model. And this is just to name a few of the concerns that were brought forward. Consultation is still underway right now, and while it sounds like youth stabilization care may not move forward using an involuntary care model, it will likely remain a government priority and be passed to health authorities to implement some form of this work. So for example, that might be a protocol enacted in every emergency department when a youth presents with an overdose. So for my project, I was asked by our mental health and substance use network to consider youth stabilization care from the perspective of public health ethics and health equity, creating a resource that can be used to ask the right questions at the right time in the planning cycle, and then facilitate the creation of ethical and equitable model, whatever that model might turn out to be. The hope was to translate an ethical framework into a usable resource that could assist in planning as things move forward. So the audience is for leaders and planners in the health authority who are involved in this work and who will be responsible for its implementation in the future. The resource takes 2 parts. The first is an ethical framework. So the ethical or any ethical analysis begins by exploring society's values in order to guide decision-making, especially where there exists scientific or professional uncertainty about an appropriate action. It requires us to ask whether or not we can justify an action as in line with our values of society, as well as whether it might be financially or clinically sound. Because many of the criticisms of the original approach to youth stabilization were of an ethical nature, we have a unique opportunity right now while the work is paused to consider ethical implications from a population level. After review of a number of ethical frameworks as part of the project, we landed on Bernheim's 3-step process, which is seen as the best guide to sort of move us forward in this work. And you can see this described on the left side of the screen now. There's a few reasons that this framework was chosen over others. First, the 3 steps were simple, clear, and easy to follow. Second, they describe and highlight the importance of trust. So particularly within the impacted community. So for substance use and the toxic drug crisis response, inclusion of people with lived and living experience is essential. And lastly, since some form of youth stabilization care is likely to be handed down for implementation, justification if and where the model infringes on ethical principles will be warranted. So as an organization, Interior Health will be better able to justify the chosen model if an ethical review is completed. It sets us up for success, especially since the evidence is very limited. On the right side of the screen, I've included a snapshot of a portion of step 1 through 3 as an example of the content that actually is in the resource. I'm not going to go through it today, but I'm happy to return if there are questions. Health equity makes up the second part of the resource. So this was originally intended to be an ethical review only. However, for youth stabilization, there seemed to be a benefit to embedding health equity as a complementary approach when planning moves forward. And there's 2 parts to the equity recommendations. First, it's really encouraged for leaders to complete a health equity impact assessment. And this is something that the health authority is already working towards and complements other planning work. These assessments help to identify unintended positive and negative outcomes from the proposed model and ensure that there's an intersectional view taken to various populations that might be vulnerable in stabilization care. This matches aspects of the ethical review in step 1, where you're identifying stakeholders impacted by the issue at hand. So they work together really synergistically. Second, within the health equity section of the resource is to consider the model through the lens of the social determinants of health. So how will youth stabilization care target multiple determinants? The more narrow the focus, the more narrow the outcomes. And this is an opportunity to see substance use and the models that we're using to address this outside of just focusing on stopping substance use or stabilizing substance use. And questions are posed on this final page of the resource, which you can see here, to incorporate social determinants into the model. So recognition that stabilization is one thing, but if youth are returned to unstable environments outside of substance use, a risk still remains to their overall health. One of the main reasons that I was really interested in taking this project on was its alignment with the realities of policymaking. So to many, including myself, it feels like it should be really obvious that evidence guides decision-making, which would then impact public and social policy. But as we've been learning in our studies, that's not how it happens. Values and ideology, evidence, and public or voter influence are all interacting to drive forward new legislation. And in this case, it's youth stabilization care. So should Bill 22 see success when it next appears in the legislature, it's going to be health authorities and other partners, of course, but that are responsible for rolling this out regardless of the evidence. So early consideration and preparation for this event will place leaders holding this responsibility in a better place to make sound decisions when faced with this dilemma. And many of the questions outlined in the resource may also lend themselves to formulating a future evaluation plan and ensure rollout is intersectional in its nature, something that's really missing from other legislation of its kind. During this consultation period, health authorities and other leaders in youth substance use have an opportunity to think through future models with a focus on both public health ethics and health equity, ensuring a level of justification regarding decisions that is not only financially and clinically sound, but then in line with our morals and values as a society. So where public will persists and evidence lacks, a sound framework and an approach needs to be in place to guide this process. So hopefully that's what this resource is providing. And that is what I have to share with you today. So thank you for listening, and I certainly welcome any questions or comments.